Stark. Q31. Which gram-positive rod forms a polypeptide capsule instead of a polysaccharide capsule? 1. Clostridium tetani. 2. Bacillus anthraqcis. 3. Corynebacterium diphtheriae. 4. Mycobacterium tuberculosis. Answer 2. Bacillus anthraqcis. Its capsule is composed of poly-D-glutamate, not polysaccharide. Q32. What is the role of the protective antigen PA in anthrax toxin? 1. Causes edema directly. 2. Forms the capsule. 3. Mediates entry of EF and LF into cells. 4. Stimulates T-cell activation. Answer 3. Mediates entry of EF and LF into cells. PA binds to host receptors and facilitates translocation of LF and EF into the cytosol. Q33. Which two components of anthrax toxin together form the lethal toxin? 1. EF plus PA. 2. LF plus EF. 3. PA plus LF. 4. PA plus capsule. Answer. PA plus LF. Lethal toxin equals protective antigen lethal factor. Which test is used to assess immunity against Corynebacterium diphtheriae? 1. Man2 test 2. Dick test 3. Schick test 4. Camp test. Answer 3. Schick test. It evaluates susceptibility to diphtheria toxin. Q35. Which component of Corynebacterium diphtheriae inhibits EF2, leading to cell death? 1. Lipid A. 2. Diphtheria toxin. 3. Streptolysin O. 4. Tetanospasmin. Answer 2. Diphtheria toxin. It irreversibly inactivates EF2, halting protein synthesis. Q36. Which diagnostic stain can detect metachromatic granules in C. diphtheria? 1. Zeal-Nielsen stain. 2. Albert stain. 3. Neisser stain. 4. Both 2 and 3. Answer 4. Both 2 and 3. Albert and Neisser stains highlight metachromatic polyphosphate granules. Q37. Which of the following is a key characteristic of Mycobacterium tuberculosis? 1. Endospore formation. 2. Polysaccharide capsule. 3. Mycolic acid in the cell wall. 4. Motility by flagella. Answer 3. Mycolic acid in the cell wall. Mycolic acid makes the cell wall waxy and acid-fast. Q38. Which drug used in tuberculosis treatment may cause optic neuritis? 1. Isoniazid. 2. Rifampin. 3. Pyrazinamide. 4. Ethambutol. Answer 4. Ethambutol. It can cause color blindness, especially red-green differentiation. Q39. Which drug inhibits mycolic acid synthesis in Mycobacterium tuberculosis? 1. Ethambutol. 2. Rifampin. 3. Isoniazid. 4. Streptomycin. Answer 3. Isoniazid. Isoniazid blocks mycolic acid synthesis. It's essential for cell wall integrity. Q40. Which acid-fast organism cannot be cultured on artificial media? 1. M. tuberculosis. 2. M. avium. 3. M. leprae. 4. M. kansasii. 3. M. leprae. It cannot be grown in vitro, only in armadillos or mouse footpads. Q41. Which treatment is standard for leprosy? Hansen's disease. 1. INH plus rifampin. 2. Rifampin plus clofazimine dapsone. 3. Ethambutol, clarithromycin. 4. Vancomycin metronidazole. Answer 2. Rifampin plus clofazimine dapsone. Multidrug therapy MDT is the gold standard for treating leprosy. Q42. Which genus includes bacteria with the longest known doubling time? 1. Corynebacterium. 2. Mycoplasma. 3. Mycobacterium. 4. Bacillus. Answer 3. Mycobacterium. Slow growth due to complex lipid-rich cell walls. Q43. Which of the following lacks a cell wall, making it resistant to beta-lactam antibiotics? 1. Mycobacterium tuberculosis. 2. Mycoplasma pneumonia. 3. Corynebacterium diphtheriae. 4. Clostridium perfringens. Answer 2. Mycoplasma pneumoniae. No cell wall, contains sterols in the membrane instead. Q44. Which receptor allows Mycoplasma pneumoniae to attach to respiratory epithelium? 1. CD4, 2. P1 adhesin to sialic acid, 3. CCR5 for IgA receptor. Answer 2. P1 adhesin to sialic acid. P1 adhesin binds to ciliated epithelial cells, impairing clearance. Q45. Which condition is commonly associated with cold agglutinins? 1. Tuberculosis. 2. Diphtheria. 3. Mycoplasma pneumoniae infection. 4. Leprosy. Answer 3. Mycoplasma pneumoniae infection. IgM antibodies can agglutinate red cells at cold temperatures. Q46. Which pathogen has intracellular lipid inclusion bodies and resists acid-alcohol decolorization? 1. Mycobacterium tuberculosis. 2. Clostridium botulinum. 3. Bacillus anthraqcis. 4. Streptococcus pneumoniae. Answer 1. Mycobacterium tuberculosis. Acid-fast bacilli due to mycolic acids in their walls. Q47. Which agent can cause necrotizing pneumonia and granulomatous inflammation? 1. Corynebacterium diphtheria. 2. Bacillus cereus, 3. Mycobacterium tuberculosis, 4. Clostridium difficile. Answer 3. Mycobacterium tuberculosis. Tuberculosis often presents with caseating granulomas and lung necrosis. Q48. Which organism is known for slow colony growth and molar tooth colony appearance? 1. Mycoplasma pneumonia, 2. Actinomyces israelii, 3. Bacillus subtilis, 4. Clostridium tetani. Answer 2. Actinomyces israelii forms characteristic molar-shaped colonies in anaerobic culture. Q49. Which microorganism is part of normal skin flora and associated with acne? 1. Mycoplasma hominis, 2. Streptomyces griseus, 3. Propionibacterium acnes, 4. Bifidobacterium brevi. Answer 3. Propionibacterium acnes. Now renamed Cutibacterium acnes, it plays a role in acne pathogenesis. Q50. Which genus is widely used as probiotic normal flora in yogurt? 1. Streptomyces, 2. Actinomyces, 3. Bifidobacterium, 4. Corynebacterium. Answer 3. Bifidobacterium. It is a common probiotic that contributes to gut health. At Q51, what is the function of edema factor, EF, in the anthrax toxin complex? 1. Acts as a pore-forming cytolysine. 2. Inhibits protein synthesis via EF2. 3. Increases intracellular CAMP, causing fluid imbalance. 4. Induces T-cell apoptosis. Answer 3. Increases intracellular CAM, causing fluid imbalance. EF is an adenylate cyclase that leads to edema by disrupting fluid homeostasis. Q52. Which bacterial species is aerobic, forms spores, and was used by Koch for pure culture development? 1. Corynebacterium diphtheriae, 2. Bacillus anthraqcis, 3. Mycobacterium tuberculosis, 4. Mycoplasma pneumoniae. Answer 2. Bacillus anthraqcis. B. Anthraqcis was the first bacterium isolated in pure culture using solid media. Q53. What is the correct staining result of C. Diphtheriae granules with methylene blue stain? 1. Blue cytoplasm with red granules, 2. Blue granules with red cytoplasm, 3. Uniform blue coloration, 4. No staining. Answer 1. Blue cytoplasm with red granules. Metachromatic granules stain red against a blue background with MB stain. Which statement correctly describes Mycobacterium tuberculosis growth characteristics? 1. Rapid growth on blood agar within 24 hours. 2. Requires anaerobic environment for growth. 3. Slow growing. Colonies appear after 3-8 weeks. 4. Requires cholesterol-enriched media for growth. Answer 3. Slow growing. Colonies appear after 3-8 weeks. M. tuberculosis is notoriously slow due to its complex cell wall structure. 55. Which antibiotic used in TB treatment induces hepatic enzymes leading to drug interactions? 1. Ethambutol, 2. Rifampin, 3. Isoniazid, 4. Pyrazinamide. Answer 2. Rifampin. Rifampin induces cytochrome P450 enzymes affecting metabolism of other drugs. Q56. Which test uses purified protein derivative PPD to detect prior TB exposure? 1. Schick test, 2. Dick test, 3. Tuberculin skin test, Mantoux, 4. Hanser, 3. Tuberculin skin test, Mantoux. The Mantoux test measures a delayed type hypersensitivity reaction to PPD. Q57. What is the mechanism of action of dapsone, a drug used in leprosy treatment? 1. Inhibits mycolic acid synthesis. 2. Inhibits DNA gyrase. 3. Inhibits folate metabolism. 4. Binds ribosomal subunit. Answer 3. Inhibits folate metabolism. Dapsone is a sulfone that blocks dihydropteroate synthase, similar to sulfonamides. Q58. Which organism is acid-fast, aerobic, and found in AIDS patients as part of Mycobacterium avium complex? 1. M. lepra, 2. M. kansasai, 3. M. tuberculosis, 4. M. intracellular. Answer 4. M. intracellular. M. avium complex includes M. avium and M. intracellular, often infecting immunocompromised hosts. Q59. Which structural component makes Mycoplasma pneumonia resistant to beta-lactam antibiotics? 1. Outer membrane. 2. Peptidoglycan crosslinks. 3. Sterol-containing membrane. 4. Lipooligosaccharide. Answer 3. Sterol-containing membrane. Lacking a cell wall, it survives via sterol-rich membrane resists penicillins. Q60. Which of the following bacteria are known for producing antibiotics and forming filamentous structures? 1. Actinomyces, 2. Propionibacterium, 3. Streptomyces, 4. Bifidobacterium. Answer 3. Streptomyces. Streptomyces species are major antibiotic producers, e.g., streptomycin, with a filamentous morphology.